Imagine a world where your medical history isn't stored on easily lost paper records or vulnerable digital databases, but invisibly embedded in your own skin. Today, we're exploring the groundbreaking development of quantum dot tattoos, microscopic markers that could transform healthcare delivery worldwide, especially in regions with limited infrastructure. These tiny semiconductor crystals, invisible to the naked eye, represent one of the most promising intersections of nanotechnology and medicine. Join us as we delve into how this technology works, why it matters, and what it could mean for the future of global health. At their core, quantum dot tattoos are built around tiny semiconductor crystals measuring just a few nanometers in diameter, so small they're measured on the same scale as DNA molecules. These dots have a remarkable property called photoluminescence. They absorb light at one wavelength and emit it at another, specifically in the near-infrared spectrum. This means they're completely invisible to the human eye but can be detected by specially modified smartphones. Unlike traditional medical devices or wearable technology, these quantum dots integrate directly with human tissue. They're encapsulated in biocompatible microparticles that prevent them from migrating throughout the body or causing adverse reactions. This encapsulation allows them to remain functional under the skin for years, creating a permanent medical record that travels with the patient wherever they go. This technology represents a sophisticated convergence of nanotechnology, materials science, and biomedical engineering that has been in development for over a decade but has only recently become viable for human applications. The driving force behind quantum dot tattoo development is a critical problem in global healthcare: the difficulty of maintaining accurate medical records in regions with limited infrastructure. In many developing countries, paper records are easily damaged by humidity, lost during relocations, or destroyed in natural disasters. Centralized digital systems often aren't viable due to inconsistent electricity, internet connectivity, or technical support. This gap in medical record keeping has devastating consequences, particularly for vaccination programs. Without reliable records, healthcare workers can't determine which vaccines a person has already received, leading to dangerous gaps in coverage or unnecessary duplicate doses. The World Health Organization estimates that improved vaccination tracking alone could prevent approximately 1.5 million deaths annually from vaccine-preventable diseases. The Bill and Melinda Gates Foundation recognized this potential and has provided significant funding for quantum dot research, seeing it as a transformative solution for vaccination tracking in resource-limited settings. The technology offers a solution that doesn't rely on consistent access to healthcare facilities, stable electricity, or internet connectivity, requirements that simply cannot be guaranteed in many parts of the world where medical needs are most significant. When administered alongside vaccines, quantum dots are delivered in specific patterns that encode information about the medication. These patterns function essentially as invisible barcodes on the skin. Health workers equipped with modified smartphones can quickly scan a patient's arm to determine which vaccines they've received, even years after administration. Recent field tests in remote areas of Bangladesh have demonstrated the technology's durability, with quantum dot patterns remaining readable for up to 2 years after application. This persistence is crucial for tracking multi-dose vaccine regimens that span several years of a child's development. The delivery system has evolved significantly from early prototypes. Rather than traditional needles, researchers have developed dissolvable microneedle patches that painlessly deliver the quantum dots. These patches, smaller than a postage stamp, contain hundreds of microscopic projections that penetrate only the uppermost layers of skin. The microneedles dissolve completely after application, leaving behind only the quantum dot pattern in a predetermined arrangement that encodes the desired medical information. The entire application process takes less than a minute and causes minimal discomfort, an important consideration for pediatric vaccinations. The technology to read quantum dot tattoos has advanced alongside the delivery systems. Modified smartphone attachments can now detect the patterns with over 99% accuracy, even in challenging lighting conditions or on different skin tones. These readers use specialized filters and image processing algorithms to enhance the near-infrared signal while filtering out background noise. The reading process is remarkably quick, taking less than 3 seconds from scan to result display. This speed makes it practical for high-volume screening in field conditions where healthcare workers may need to process many patients in a limited time. When the modified smartphone is held over the quantum dot tattoo, it emits a specific wavelength of light that excites the quantum dots. The dots respond by emitting near-infrared light in their encoded pattern, which is captured by the smartphone's camera through specialized filters. The application then processes this image, identifies the pattern, and translates it into readable medical information on the screen. This could show which vaccines have been administered, when they were given, and when the next doses are due. The latest iterations of quantum dot tattoos have overcome several previous limitations, particularly regarding long-term safety. The newest formulations use demonstrably non-toxic and biodegradable materials that remain stable over extended periods. Importantly, modern quantum dots are composed of copper-based compounds rather than the potentially harmful heavy metals used in earlier versions. This shift addresses one of the most significant safety concerns that had previously limited human applications. The biocompatible microparticles that encapsulate the quantum dots have also been refined through years of research. These particles are designed to remain in place under the skin without triggering immune responses or inflammation. Extensive testing in both laboratory and field conditions has confirmed their safety profile, with no significant adverse events reported in trials. The entire system is designed with biocompatibility as a primary consideration, ensuring that the quantum dots can remain in place for years without causing harm or discomfort to the patient. This long-term safety profile is essential for a technology intended to provide medical records that may need to last throughout childhood or even into adulthood. Recent innovations have dramatically expanded the information density of quantum dot tattoos. While early versions could only store binary information, essentially just indicating whether a vaccine was present or not, newer encoding techniques can store the equivalent of several kilobytes of data in an area smaller than a dime. This increased capacity transforms the technology from a simple yes/no indicator to a comprehensive medical record. Modern quantum dot patterns can encode which vaccines have been administered, batch numbers for quality control and recall purposes, administration dates, and even basic patient identification information when appropriate. The encoding system uses variations in dot spacing, size, and arrangement to create complex patterns that function like two-dimensional barcodes. Different pattern sections can correspond to different vaccines or medications, creating a complete vaccination history in a single small area of skin. Some advanced systems even incorporate error correction codes, ensuring that the information remains readable even if parts of the pattern fade or become damaged over time. This redundancy is crucial for a medical record that might need to remain accurate for years or decades. The practical viability of quantum dot tattoos has been demonstrated through extensive field testing in remote areas of Bangladesh, where maintaining vaccination records has historically been challenging. These tests have shown promising results, with the quantum dot patterns remaining readable for up to 2 years after application, long enough to track multi-dose vaccine regimens that span several years of a child's development. In regions where families may relocate frequently or multiple healthcare providers operate independently, having the medical record travel with the patient eliminates dangerous gaps in care continuity. The field tests involved real-world conditions that would challenge any medical technology: inconsistent electricity, limited refrigeration for vaccines, varying levels of healthcare worker training, and patients who often traveled long distances between medical visits. Despite these challenges, the quantum dot system maintained high reliability. Healthcare workers using the modified smartphones were able to accurately read the quantum dot patterns with minimal training, and the scanning process integrated smoothly into existing vaccination workflows. Patient acceptance was also high, with many families appreciating the security of knowing their children's vaccination history couldn't be lost or damaged. As quantum dot tattoo technology moves closer to widespread implementation, it has prompted essential discussions about privacy, consent, and data security. Critics have raised legitimate concerns about potential surveillance applications or unauthorized scanning of individuals' medical information. These concerns are particularly relevant in regions where political instability might lead to misuse of medical data for non-health purposes. Researchers have responded to these concerns by implementing several protective measures. Encryption protocols require specific authorization to read the information, preventing casual or unauthorized scanning. The system is designed to store only minimal, essential medical data rather than comprehensive personal information, limiting potential privacy violations. Additionally, community engagement initiatives in test regions have focused on transparent communication about how the technology works, what information it contains, and who can access it. Ethical frameworks for implementation emphasize informed consent, with clear explanations provided to patients or parents about the nature of the quantum dot records. Cultural sensitivities around marking the body are also being carefully considered, with implementations adapted to respect local beliefs and practices. While vaccine tracking represents the initial focus for quantum dot tattoos, researchers are already exploring additional applications that could further transform healthcare. Current research includes using similar systems to monitor glucose levels in diabetic patients, potentially replacing painful finger prick tests with a simple smartphone scan of quantum dots calibrated to react to changing glucose levels. Other applications in development include tracking medication compliance in patients with chronic conditions like tuberculosis or HIV, where consistent adherence to drug regimens is crucial for treatment success. Perhaps most exciting are systems designed to detect early disease biomarkers before symptoms appear. Quantum dots could be engineered to react to specific proteins or compounds associated with disease onset, creating an early warning system embedded in the skin. Some researchers envision systems that continuously monitor key health indicators and alert patients or healthcare providers when intervention is needed. These applications could be particularly valuable in regions with limited access to diagnostic laboratories or regular medical care. The technology could eventually evolve into a comprehensive health monitoring system that bridges the gap between episodic medical visits, providing continuous health surveillance without requiring constant connection to healthcare facilities. Despite the promising advances, quantum dot tattoo technology has faced several technical challenges that researchers continue to address. One significant hurdle has been ensuring consistent readability across different skin tones and textures. Early versions showed varying performance depending on melanin levels, potentially creating inequitable access. Engineers have responded by developing more sophisticated reading algorithms that can compensate for different skin properties and ensure consistent results regardless of a patient's skin color. Another challenge involves the longevity of the quantum dots themselves. While current formulations remain readable for up to 2 years, some vaccination schedules require tracking over 5 or more years. Researchers are working on enhanced encapsulation methods that could extend the functional lifespan of the quantum dots without compromising safety. The reading technology has also required significant refinement. Early scanners were bulky and expensive, limiting deployment in resource-constrained settings. The evolution to smartphone-based readers represents a major breakthrough, but continues to be refined for durability in harsh field conditions, battery efficiency, and ease of use by minimally trained personnel. Each iteration of the technology brings improvements in these areas, gradually overcoming the practical barriers to widespread implementation. The potential impact of quantum dot tattoos on global health is difficult to overstate. In regions where medical infrastructure remains limited, this technology could fundamentally transform how preventive healthcare is delivered and tracked. The World Health Organization estimates that approximately 19.7 million children worldwide miss crucial vaccinations each year, often due to record-keeping failures rather than vaccine availability. By addressing this documentation gap, quantum dot technology could help prevent approximately 1.5 million deaths annually from vaccine-preventable diseases. Beyond the direct health benefits, the economic implications are substantial. The cost of implementing quantum dot systems is projected to be significantly lower than establishing and maintaining traditional medical record infrastructure in developing regions. The technology requires minimal ongoing investment once deployed, with the smartphone readers representing the primary equipment cost. This economic efficiency makes it particularly attractive for global health initiatives operating with limited budgets. Perhaps most importantly, quantum dot tattoos could help address health inequities by providing consistent care quality regardless of a region's existing infrastructure. Rural and remote populations, who often suffer the most from fragmented medical records, would benefit from having their essential health information always available, even when traveling between different healthcare providers or regions. As quantum dot tattoos transition from experimental technology to practical tools, researchers and health organizations are developing comprehensive implementation roadmaps. These plans address not only the technical aspects of deployment but also the complex social, political, and logistical challenges of introducing novel medical technology in diverse settings. Training programs for healthcare workers represent a critical component of successful implementation. These programs must be culturally appropriate and accessible to workers with varying levels of technical familiarity. Simplified visual guides, hands-on practice sessions, and peer-to-peer training models have proven effective in pilot programs. Supply chain considerations present another challenge. The quantum dot materials, microneedle patches, and smartphone readers must reach remote locations alongside the vaccines they track. Integration with existing vaccine distribution networks offers the most efficient approach, but requires careful coordination between technology providers and health ministries. Regulatory approval processes vary significantly between countries, creating a complex patchwork of requirements that must be navigated for global implementation. Some regions have established accelerated review processes for technologies addressing critical public health needs, potentially speeding adoption. Perhaps most challenging are the cultural and social factors that influence acceptance. Religious or cultural beliefs about marking the body, concerns about privacy, and general suspicion of new technologies must all be addressed through thoughtful community engagement and clear communication about benefits and limitations. From the patient's perspective, quantum dot tattoos offer a remarkably unobtrusive medical record system. The application process is virtually painless. Many recipients report feeling only a slight pressure as the microneedle patch is applied, significantly less uncomfortable than traditional injections. Once applied, the quantum dots are completely invisible and impalpable. Patients cannot see or feel them, even knowing exactly where they're located. This invisibility addresses potential stigma concerns that might arise with visible medical markers. When scanning is required, the process is quick and non-invasive. The healthcare worker simply holds the modified smartphone near the application site for a few seconds while the device reads the pattern. No physical contact is necessary beyond what would occur in a normal medical examination. For parents of young children, the system offers peace of mind that their child's vaccination history remains intact even if paper records are lost or damaged. In regions where families may relocate frequently due to economic necessity or instability, this continuous record ensures that children can continue their vaccination schedules without unnecessary repetition or dangerous gaps. Patient interviews from field trials indicate high satisfaction with the system, with many expressing appreciation for the simplicity and reliability compared to traditional paper records that must be carefully preserved between visits. Quantum dot tattoos represent a fundamental paradigm shift in how we conceptualize medical record-keeping, moving from institution-centered documentation to patient-centered, embodied information. Throughout medical history, records have been maintained by healthcare providers, first on paper, then in digital systems, with patients having limited access or control. This traditional approach places the burden of continuity on systems that often fail, particularly in resource-limited settings. The quantum dot approach inverts this relationship, embedding essential medical information within the patient's own body. This shift has profound implications for patient autonomy and healthcare delivery models. When medical records travel with the patient, power dynamics between healthcare providers and recipients begin to change. Patients become carriers of their own medical history rather than dependent on institutional memory or documentation. For populations that have historically been marginalized by healthcare systems, this autonomy can be particularly meaningful. The technology also challenges our traditional separation between medical information and the physical body. While this integration raises important ethical questions, it also offers a pragmatic solution to persistent documentation problems that have real health consequences. As this technology matures, it may fundamentally transform how we approach preventive healthcare, particularly for the world's most vulnerable populations who have been poorly served by traditional record-keeping systems. Quantum dot tattoos stand at the intersection of nanotechnology, medicine, and global health policy, offering a solution to one of the most persistent challenges in healthcare delivery: maintaining accurate medical records across time, distance, and limited infrastructure. By embedding invisible, scannable information directly within the body, this technology creates a patient-centered record system that cannot be lost, damaged, or separated from the individual it serves. The implications for global vaccination efforts alone are profound, with the potential to save millions of lives by ensuring complete and timely immunization coverage. As we've explored throughout this video, the journey from laboratory concept to field-ready technology has required innovations across multiple disciplines, from materials science that created biocompatible quantum dots to the sophisticated encoding systems that maximize information density in microscopic patterns. The technology continues to evolve, addressing challenges of longevity, readability across different skin types, and expanding applications beyond vaccination to chronic disease management and preventive health monitoring. Yet perhaps the most important aspect of quantum dot tattoos is how they shift power in healthcare relationships, embedding medical information within the patient rather than institutional systems. This represents a fundamental rethinking of medical record-keeping that could particularly benefit the world's most vulnerable populations. As field implementation expands from test sites to broader deployment, the technology promises to bridge critical gaps in global health infrastructure while raising important questions about privacy, consent, and the relationship between our bodies and the information they carry. Quantum dot tattoos exemplify how nanotechnology can address pressing human needs through innovation that is invisible to the eye yet potentially transformative for global health. Thanks for watching. Please like, subscribe, and hit the bell icon for updates. Your feedback is appreciated. We hope to see you again.